Hello, my name is Camila, and we have Yelena and Nicole here. We will be doing a teaching session for fall prevention. Good morning, Mr. and Mrs. MP. My name is Camila, and I will be your nurse for today.
Hello, Camila. Nice to meet you.
Nice to meet you, Camila.
How are you feeling, Mr. MP?
I'm feeling okay so far. Thank you.
Good to hear that. I can see that you will be discharged today, but before you leave, we will discuss ways to prevent future falls. Is it okay if I ask you a few questions, Mrs. MP?
Yes.
Mrs. MP, were you there when the incident happened?
Yes. I was there, and the way he hit his head concerns me a lot.
I can see his results so far. There is nothing to be concerned about, just the hematoma on his forehead, and also the CT result is normal. Mr. MP, can you tell me more about how you fell? Was the floor slippery? Did you step on something like a soap bar? Did you feel dizzy? Or did you get up really fast or move really fast?
Well, I was showering, and when I got up to grab my towels, my feet slipped and I fell in the bathtub. And at the same time, I think I moved really fast and I couldn't hold myself.
I've always been worried that might happen, so I always tell him to get up slowly and grab onto something whenever he reaches for any object.
Mrs. MP, I completely understand your concern. By looking at Mr. MP's vitals as well, I can see that Mr. MP has a bit of a higher blood pressure. Mr. MP, do you always have a high blood pressure?
Yes, I do, but it is not normally this high.
Okay. Have you discussed this with your doctor?
Yes, yes, I'm taking medication for blood pressure.
Okay. As I mentioned earlier, we will briefly talk about certain things that can cause fall and the measures to take to prevent it from happening again. Mrs. MP, can you be part of this session as well?
Yeah, of course. I can definitely reinforce him and make sure to strictly follow.
I would like, that's great. I would like Mr. MP to keep an eye, keep examining his head and keep an eye on any other symptoms to make sure his condition is getting better.
But before we proceed, I would like to ask if falling is a normal occurrence when we get old.
Good question, Mr. MP. But even though fall is very common, mostly in elderly, I would say yes. Because as we get older, some parts of our body's strength weaken. However, there are some strategies that will help to prevent falls.
I understand. So what are some examples of these strategies?
So here we will have some strategies that will help you from falling. So make sure you clean up your clutter, remove or repair any tripping hazards. You can also install grab bars and handrails to hold on to, especially when you're going up the stairs and using the bathroom. Also, I recommend using a top transfer bench, a shower chair, grab bars, and a handled shower head to prevent slipping and falling in the shower. It is also recommended that you add a non-slip mat to your bathtub. Also, move carefully, if possible, slowly, and also keep night lights on. I recommend to use the ones that are motion sensitive because it is more convenient and safe as it turns on automatically as soon as you get up from your bed or whenever you walk in the hallway. Also, make sure that the floor isn't wet and all the carpets are fixed firmly to the floor so you won't slip. Also, always have a large printed emergency number around the house in case an accident happened and your wife is not there. What else you can do is maybe you can use assistive devices when walking, and also keep your glasses available if you wear one.
Okay, thank you, Camila. I will make sure to follow the strategies and make sure to buy a mobility device to prevent myself from falling from now on. And of course, I'm going to wear my glasses.
Yeah, we will also buy a walker or a crane later after you get discharged. I will also make sure to remove any objects that may cause my husband to fall.
That's good. So how do you both feel about applying these changes that we've discussed?
I would say that most of them are easy to follow, so I think it is doable.
Great. Let's see what you have remembered from what we've discussed today.
Okay, today I learned that there are a lot of things I can do to prevent myself from falling again, including removing the clutters, making sure that cords are tied up or out of walking paths, and making sure that all loose rugs are fixed on the floor to avoid tripping. And I will also start using a mobility device to help me avoid falling or tripping.
Yes, and also we will definitely install grab bars and put shower chairs in the bathroom so that this will never happen again. I will make sure to check and remove any hazards as soon as we get home.
Great job. Since you and your wife understand and were able to identify hazards and demonstrate ways to prevent falls in your household, I will also give you some printouts, brochures that will help you to understand about what we've just discussed today. So here is the brochure.
Thank you, Camila.
Thank you.
You're welcome. And if you follow these strategies, the risk of fall will definitely reduce. If you, in addition, if you have any further questions to ask, you can contact us or your family doctor. I would like to thank you so much and have a wonderful day.
Thank you, Camila, for this useful session. And I think these strategies will help me to prevent from future falls.
Have a
You-
wonderful day as well, Camilla. Thank you for your help.
You're welcome.